I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means we are experienced and skilled in what we do, helping people achieve success in the OET exam. So in today's video, we're going to look at how you are examined in the OET speaking test. There are two sets of criteria, linguistic and the clinical communication criteria. In this video, we're only going to look at the clinical communication criteria. If you would like information on the linguistic one, check out our other video. The link is below. So today, we will look at an overview of the clinical communication criteria, what they mean, and how to meet the criteria. So how are you assessed on your clinical communication skills? Well, there are 5 aspects that the examiner will look at.
And these are relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. And each one is marked on a scale from 0 to 3, with 3 as the highest score.
So what does each one involve?
You can see here the 5 criteria headings and a breakdown into smaller indicators, which can help us to understand what the examiner is looking for. A copy of this is available to download on the OET website.
So how can you use the criteria to help you in your OET preparation? In order to help you prepare for the OET speaking exam, you need to understand what each criterion means. Let's examine them one by one. We'll start with relationship building.
This involves introducing yourself appropriately, listening carefully with respect, showing that you care about the patient, and avoiding judgment. Here's some examples on how you can achieve good score in relationship building. Introduce yourself clearly. For example, "Good morning, I'm Dr. Gray. What can I do you for today?" Show respect. For example, "Would you mind if I check your blood pressure? Is it okay with you if I take a closer look at your wrist?" Asking permission. And show empathy. For example, say something like, "I know this won't be easy, but it's important that you consider reducing your smoking."
The role play should be patient-centered. And this is what the next criterion is about, dealing with the patient's ideas, concerns, and expectations, or ICE.
This involves finding out what is worrying the patient and making sure your responses deal with the patient's ideas, concerns, and expectations. So it's best to ask the patient an open question at the start of the role play to get information on their mood. For example, "So Matthew, what brings you here today?" Once you hear the patient's concerns, you should try and relate back to them in your explanations. To understand and incorporate the patient's perspective is key in the role play. The role play has to focus on encouraging the patient to openly explain their concerns. So you should establish the concerns of the patient. "So can you tell me what brings you here today?" Or, "Is there anything that worries you about that?" Pick up on their verbal and non-verbal hints. For example, "I sense you are nervous about this operation. However, I can assure you that it's a very common procedure." And relate your advice back to what they have said. For example, "You mentioned your worry about slow healing. Well."
Let's move on to the next criterion, which is providing structure. Although the role play should be patient-centered, it's important that you lead the conversation, not the patient.
This criterion involves organising the role play logically, using clear signposting phrases to move from one topic to the next, and using linking phrases in explanations. You should lead the role play, so try to make the sequence of the interview logical and clear for the patient. Follow a logical sequence in your role play. For example, the medical condition, explanation of procedure, advice on medication. Use language to signpost a change in the topic. For example, "Now we've talked about the reasons for asthma, let me show you how to use the inhaler." pause to emphasize moving from one point to another. For example, okay, let's recap on how you'll take this medication. And use linking phrases in explanations.
Now moving on to information gathering.
This criterion involves being an active listener, using open questions followed by closed questions, avoiding compound questions, so two questions together, and asking questions and repeating information to clarify patient's meaning. So it's important to be an active listener. Remember, there is no video, so use silence, pausing, echoing, and repetition to show that you are an active listener. Start with an open question. So what can I do you for today? Or could you tell me a bit about your symptoms? Then let the patient talk while you make noises as fillers to show that you are listening. For example, yes, I see, okay, oh dear. Then move forward into your closed questions, the yes-no questions. Don't use compound questions, so two questions together. This is mainly because compound questions are harder to answer and information may be left out. Try to ask clear and direct, separate questions rather than asking for too much detail in one go. You can also ask questions and repeat what the patient has said to check you have understood the information correctly or clarify anything which is unclear. For example, you might say, "What do you mean by feeling funny?" to get the patient to explain what they mean.
In most role plays, there is usually a need for providing information. So let's take a look at what this involves.
You will need to gather information from the patient or carer, as this will tell you what information they need to know and guide you in your explanations. First, find out what the patient knows. Avoid talking non-stop as you give the patient information. It's much better to chunk the information into manageable amounts and keep checking that the patient is following you. Also, check for further questions.
Gather the knowledge that the patient already has so you can be sure you are giving them the right information.
Find out what the patient already knows. So say something like, "Can you tell me what you already know about eczema?" before you fill in the gaps in their knowledge. Avoid talking non-stop as you give patient information. It's much better to chunk the information into manageable amounts and keep checking that the patient is following you, saying something like, "Is that all right? Is that okay?" And check for any further questions the patient might have. For example, say, "Is there anything else you'd like to ask me?"
Top tips for performing well on the clinical communication criteria. Make sure you really understand what each criterion means. Think about making a checklist as a reminder to focus your practice. And be sure to practice with your teacher, colleagues, or family or friends. So thanks for watching. If you would like more tips and strategies on how to prepare for the OET exam, check out our website, link below. Please like and share so we can help more people achieve success in the OET exam. Don't forget to subscribe for more videos like this. Bye!